Thank you very much for joining us tonight, and welcome to the PharmAssist MedTeach program. Before we begin, we have a very quick disclaimer that we wanted to read off. The PharmAssist MedTeach program, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the MedTeach nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professional. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And we will read that a couple times throughout the course of the program tonight, just as a reminder. But thank you again for joining us tonight. The PharmAssist MedTeach program every Monday night at 7 p.m., where we bring on wonderful and amazing nurses across the nation to come on and talk through a couple of different fertility medications. Follow that up with some Q&A that you can join in and ask live. So tonight, we are lucky to be joined by the fabulous Karen Hammond. So Karen, I will kick it over to you. Thank you very much. And everybody, welcome to the program. Take it away, Karen.
Thank you so much, Craig, and thank you all for joining us tonight. There are a few medications that I'm going to talk to you about, and the first thing I want you to know is this is going to be easy, and your injections are going to be easy, and we're going to make sure you're very comfortable with it. My name is Karen Hammond, and I'm a women's healthcare nurse practitioner and the IVF program director at a pretty big IVF program in Birmingham, Alabama. And I'm going to talk to you about 3 medicines: HCG, Ovidrel, and Progesterone in Oil. This is kind of perfect timing for me because if you're one of my patients, chances are you're going to be taking one or two of these medicines starting this week. Anyway, I want this to be very easy for you. Sit back and relax and know that you can access this program again if you need a refresher on Facebook at Mandels pharmacy.com. And these will all be archived for you to look at your convenience. Again, I'm going to talk to you about just some general information, exactly how to do these injections, but your healthcare provider will tell you exactly what he or she wants you to do, about specifics and about timing. So I'm going to start out by introducing the first medication. It's HCG. That's human chorionic gonadotropin. So you know why we just call it by the letters. It's a mouthful. And this drug mimics the LH surge. So it acts like LH to do the final maturation of your eggs. And unless an egg retrieval is done, it will cause those eggs to be released from the follicles. So Craig, if you'll start out in the video, and then we'll answer some questions at the end of it. You have been prescribed to take HCG by your healthcare provider. You should have been told a specific time to take this medicine because this does the final maturation of your eggs to prepare them for either ovulation or egg retrieval. It's actually quite simple to do this. There are a couple of routes of administration you can do this. Your healthcare provider will tell you whether or not to take this injection directly in the muscle or just into subcutaneous fat. So we'll go through both those ways. If you've been prescribed to take this medicine just subcutaneously, then that should be given in the area beneath your belly button and out to the side, or in your outer thigh. To do that, you just bunch up a little bit of tissue and put the needle straight in. If you've been prescribed to take this medication intramuscularly, it should go in the muscle of your hip. To do this, just put your hand on your hip bone, and way up in the upper outer quadrant is where you'll give this injection. And you can see in this picture, it's the upper outer quadrant. Your nurse or healthcare provider will be happy to point out exactly where you should give this medication and whether you should take it intramuscularly or subcutaneously. To mix a medication, it's actually quite simple. You'll need the contents of the box of the HCG, which will have a vial that has liquid and a vial that has a little bit of powder in there. It may actually look like a little cake. Next, you'll need a syringe to mix the medication and to draw it up for injection. Start by removing the cap from each bottle, just by lifting it up. The powder and the liquid. just lifting it up to remove it. Next, open this package that has the syringe and the attached needle. And then remove the top from the needle just by pulling it straight off. Next, take the tip of the needle and insert it into the middle of the rubber part of the vial. You'll want to be able to see the needle in the liquid. Although there are 10 cc's of liquid in the bottle, you're really only going to need about 1 cc. The exact amount of liquid doesn't really matter. The liquid is simply to dissolve the powder. I generally tell patients to withdraw 1 cc. And you do that by just gently pulling back, making sure that the needle can be seen in the liquid. If you have a little air in there, that's okay. Then take it out. Just push straight up to make any air bubbles come out. And then take the bottle of powder and insert the needle into the same place at the top of the vial. Push in all of the liquid, and the powder should dissolve pretty instantly. If necessary, you can just swirl it around a little bit and it dissolves very quickly. Then turn the vial upside down, again making sure you can see the tip of the needle in the fluid, and withdraw all of that mixture. And remove the needle from the vial. If you've been told to take this medication intramuscularly, it's ready to give. The needle's already on. You just simply need to choose your injection site. If it's going to go in the muscle, it'll be this needle. You separate the tissue so that it'll go deep into the muscle. One wipe with alcohol, and then put the needle straight in all the way. Pull back on the plunger just a little bit. You're probably going to get a little bit of air back. That's completely normal. If you get blood, just pull back just a tiny bit on the needle and go ahead and push the medication in. And then pull the needle out straight, all the way out. If you have a little drop of fluid or a little drop of blood, that's completely normal. Just wipe it with an alcohol pad, and you can apply a bandage if necessary. Then you can carefully recap the needle, remove it, and place it into a sharps container just to avoid any injury later on. If the medication has been prescribed for you to take subcutaneously, choose the injection site and change and put on one of the smaller needles that will be prescribed that will be sent to you with your medications. The needle will just similarly screw right on the tip of the syringe. Choose your injection site, wipe it just once with a little bit of alcohol, bunch up the tissue, and take the needle, put it straight in all the way, inject the medicine, release the plunger, pull it straight back all the way. Recap the needle and place the needle and syringe directly into your sharps container. Congratulations, you've now reconstituted and administered your HCG injection. So how easy was that? I know it's a little bit intimidating because it's an important injection. All of them are important injections, but this one is going to be likely told to be given at a very specific time, maybe even in the middle of the night or the wee hours of the morning. So you might just want to refresh yourself exactly how to do the injection so you'll be right ready to go when it's that perfect time. I'd like to open it up and answer any questions that you may have. And you can type in your questions either through Zoom or through the Facebook Live.
Perfect. You're doing my job for me. You're explaining the things that I thought I was going to have to do. Thank you, Karen. Yes, and one quick reminder to everybody that we do want to keep our questions focused on general product usage again. Try not to ask questions about specific clinical questions. Those are things that should be directed to your healthcare professional. So we do have one quick question just popped in now that says here, Karen, okay, I was prescribed Pregnyl and my sister received Novarel. Is there a difference between the various brands? Do they work differently? Should I know something different about mine versus hers?
These medicines are essentially the same thing. They're generic equivalents. The two brands that are most widely available right now are Pregnyl and Novarel. The Novarel can come in two different strengths, either 5,000 or 10,000 units. So your provider will tell you which dosage is right for you, and that's what Mandel's will send to you. The medications are the same, they're administered the same, but the little amount of powder, the little cake that's at the very bottom, may look a little bit different. There may be a little bit more, a little bit less in one brand than the other, but those are generic equivalents.
Perfect. Thank you for that answer. And Karen, actually, something came in similar. We'll jump to it right now. It says said my vial has a hard tablet, or it almost looks like a pill in it. It's not powder. Does that mean something's wrong? Is it old? Do I need to have it replaced?
Doesn't matter at all. That's a great question. And it's always important whenever you get your medications, you want to take a look at them. Make sure that the liquids are nice and clear. And when you take a look at the powder, just make sure there's powder in there. It can settle and make almost like a little tiny pill at the very bottom. And if it does, that's not a problem at all, because as soon as you put the liquid in through that rubber stopper at the very top of the vial, as soon as you inject the liquid, it's going to dissolve pretty instantly. So don't worry if it looks like it's crumbled up, or if it's totally like a little pill, or if it's strictly powder. As soon as the liquid hits it, it's going to dissolve instantly. You may want to just swirl it around a little bit just to make sure that everything's dissolved, and then it's ready to give.
Sounds good, and thank you. Now, this question came in. It's a little bit of a different one. So this we typically, like we said, we don't actually talk to specific dosages of any medication, but we try to answer a question if it's more general around dosage, understanding your dosage or things like that. So I'm going to throw you a bit of a curveball. Just be prepared that we were just talking about HCG, but this question came in, and I don't want to ignore that somebody is actually asking a GONAL-F question. So we might as well take it and see.
Absolutely.
So an anonymous attendee in the Zoom room asked us, I was curious, how is my GONAL-F dosage amount determined?
Oh, that's a great question. And that's a question that a lot of people that are brand new to the field want to know as well. The dosage is based on each individual patient. Sometimes it has to do with what your ovarian reserve testing happens to be, such as your AMH, anti-Mullerian hormone blood test, follicle stimulating hormone or FSH blood test, and sometimes by ultrasound with an antral follicle count that just shows us about how many tiny follicles that you have early in your cycle, usually on about the third day, give or take a day or two. It's also based on other things that are individualized, such as your age, your body mass index, and your response to taking medicines in the past. So generally, your provider will look at all of these factors and maybe some others as well to help determine what the right dosage is for you. Great question.
Thank you very much. You handled that very well. It was a little bit out of left field, but that's what we're here for.
I'll take them.
We got it. All right. So I have another question here that says, another anonymous one, do I need to be worried if my HCG vial has less powder in it than it did last time? How do I know it's the correct amount? Should I be worried?
When you get your medications, including your HCG, you're going to have to pop the top off of each vial. When that vial is sealed, there's not a way that it can be tampered with or medication can leak out. So if it looks like there's a little more or a little less powder, it's still going to be the right amount. It may have just settled a little bit more or moved about during shipping, but nevertheless, you're going to have the right amount as long as that little top that's on the top of each vial hasn't been opened. So don't worry about that at all. And again, as I said earlier, some of the different brands look a little bit different, and it'll look like it has more or less in there.
Thank you, Karen, very, very much. So as of right now, that looks like the last question that has come in. One thing we always want to remind people, don't feel like you have to rush to try to get your answer in your question in right now. We will, at the end, open it up to pretty much anything if you have any questions about all three so that you have time. But in the meantime, Karen, I'll just say if there's anything else you wanted to share or anything else you want to before we move on to the next product, feel free. It's up to you. The floor is yours.
Perfect. So just listen to the advice of your healthcare provider to know whether you should take it in the muscle or just in the fat. Sometimes when you take this injection, it can cause a little redness right at the injection site that may last a day or two. Doesn't happen every time. If it does, it's not a problem at all. The medication's still absorbed. It just might have a little bit of redness or local irritation. So don't worry about that. And don't worry about giving the injection. You're going to be amazed how easy it is. Just like when you've given any other injection for the first time, it's always intimidating. But after you've done it, you think, oh, that was it. That was so easy. Do we have any other questions, Craig?
No, we are good to go right now. We can move on to the next product. And if there are any questions come up, I'll be sure to bring them up when they come.
Perfect. The next medication that I wanted to talk to you about administering tonight is called Ovidrel. This works just like HCG, and in fact, it's recombinant or man-made HCG, where the other is a human-derived product. This one is made in the laboratory. It's also going to be prescribed to you to take most likely subcutaneously, and your healthcare provider will tell you an exact time to take it. Usually it's calculated a certain number of hours prior to an insemination or an egg retrieval, or when they think that your provider thinks that the follicles are going to be mature enough to release mature eggs. So Craig, if you'll go ahead and cue up that video, then I'll be happy to take questions about Ovidrel at the end. I'd like to talk to you about administering Ovidrel. If your prescriber has recommended you take Ovidrel, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Ovidrel comes in a little package like this, and you simply open it up and remove the inside part, like that. Fortunately, with this medicine, it's in a pre-filled syringe, so the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or two and down an inch or two, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Ovidrel. That one was short and sweet, really easy to do. A question that people ask me often is, why do sometimes you get prescribed HCG and why do sometimes you get prescribed Ovidrel? That's an individualized prescriber preference, but it may also be based on specific characteristics about you, just like we mentioned earlier with the Gonal-F. So your provider will prescribe and order these medications through Mandel's, and the right one will be sent to you. So I'll open up now to any questions that you may have.
Perfect. Okay. Thank you very much. I think I'm actually supposed to read the disclaimer one more time. So let's just say again, the PharmAssist MedTeach program brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the MedTeach nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And with that being said, I have a question here for you that says, a friend of mine had a bubble in her vial of Ovidrel, but she said that it wasn't a problem. Is that true, or can it be dangerous?
That's a great question, and that's something that everybody worries about. I think we've all watched too many soap operas and movies, and we see the way to bump somebody off is just to put a little bit of an air in a syringe and inject it. But actually, you'd have to give a whole lot of air directly into an IV for you to even your heart to even skip a beat. So don't worry about that at all. Don't try to thump it and do everything that you can to try to get out every little last bit of air. That's not going to cause any harm, any danger, any pain. Don't worry about it at all. If you see a big bubble in there, you can try to get it out, but those little tiny ones, don't worry about that at all.
Perfect. And also, I guess we learned to not get any of our medical information from soap operas. So
Exactly.
once again, learning things outside the bubble here, no pun intended, when you come to the PharmAssist program. Okay, we have another question here. It says that last time I took my Ovidrel, I experienced a reaction near the injection site that was very itchy. Is there anything that I can use to treat it? Should it be before or after the shot?
Great question. Most commonly, a little local reaction is going to be after taking the human-derived HCG, not the Ovidrel. But no matter what, if you have a little localized injection site reaction, it's fine to put a little topical anti-itch cream, maybe some Benadryl cream, something like that. It's fine just to apply that topically. But if you do have that happen, it's self-limiting. It may feel like a mosquito bite for a day or two and it's going to go away. That in no way implies that the drug wasn't appropriately administered or appropriately absorbed. As long as you give it, it's going to be absorbed just like it needs to, and you have no worries about any local reactions at all. It's very uncommon to see that with Ovidrel.
Thank you, Karen, very much. So there is a question. You touched a little bit on this, but I think this question has come up before, so it's worth touching on. My nurse keeps referring to it as the trigger shot. What specifically does the trigger mean, and what is Ovidrel actually doing as part of my cycle?
Great question. A lot of people do call it a trigger shot. I don't generally call it that, and I thought that was something that patients said, but I hear a lot of providers say that as well. So it triggers a couple of things, both the HCG and the Ovidrel. It triggers the final maturation of the eggs. Right before the LH surge or the administration of HCG or Ovidrel, the egg's real sticky and it'll stick to the inside of the follicle wall. And if you try to do an egg retrieval and somebody didn't take their HCG, it is dang near impossible to be able to get the egg out. Two, not only is it sticky, but it also hasn't quite finished maturing in this Ovidrel or HCG helps the egg to finish maturing. Now, if you don't do an egg retrieval, if perhaps you're taking this for timed intercourse or maybe for ovulation induction with an insemination, this will be told to be given to you at a specific time so you'll know right when to schedule that procedure or to have intercourse. If that's the case, the egg is going to release after a certain number of hours. It's probably between 40 and 44 hours after the HCG that the egg will release, but generally it's between 34 and 38 hours that the final maturation will occur. That's another little thing that I should probably mention here. If you were told to take your HCG, for example, 35 or 36 hours before your egg retrieval, and the office is running behind, and now it's 36 and a half hours or 37 hours, don't freak out and think it's going to make you ovulate. There's always a little wiggle room that we as clinicians will give, so to make sure that you're not going to ovulate just before your procedure is scheduled.
It was very in-depth, and thank you very much for giving all the information. See, these are the things that people really, sometimes we think people understand what's happening with all the different shots, but that's why we like doing these types of open discussions so people can see what their questions might be that they maybe don't get to ask when they're sitting in front of their healthcare provider. So here's a question that maybe is pretty apropos right now. I'm going away on vacation this weekend. Do I need to keep my Ovidrel refrigerated or in a cooler or something while I travel, or will it be okay? The heat wave.
Yeah, I would recommend that you keep your Ovidrel in the fridge, just because it's it's July. But whenever it is, you want to keep it cool. Look at the back of the box, and it'll tell you to keep it cool. And that's exactly what you should do. Now, if you're going to your parents' house to have dinner and you need to take the injection in 4 hours, I wouldn't worry about refrigerating it just for 4 hours or packing an ice pack or something like that to go to your folks' house. But if it's going to be for more than 6 or 8 hours, I would recommend that you keep it refrigerated, and certainly if you're traveling, to keep it on an ice pack or in a cooler. Don't want to freeze it, but you want to just keep it nice and cool.
Great, thank you very much. And that is that's the last question we have right now. Again, remember, if you think of something after the fact, you can by all means bring that up at the end once we get to more of an open session. And another thing, if you have any questions that build upon somebody else's, something we see that happen a lot where somebody asks a question based on an answer that Karen gave to another question. So feel free to jump in and keep the conversation going. But other than that, right now we are done with the Ovidrel questions that are in, right? So I'll throw it back over to you, Karen, to just, as we get ready to move on.
All right, that sounds perfect. And always feel free to ask your healthcare provider any questions that you have. Sometimes I know when I'm going to see my own providers, I'll feel a little bit nervous or maybe forgetful, or maybe that's my age, who knows. But I'll jot down some notes and have my notes ready so that if I have some particular questions I want to make sure are answered, I've got them right there in front of me, a little sticky note that I can remember to ask. But this is a great forum to ask questions as well. The last product I wanted to talk to you about is the one that I probably get the most questions about, and it is Progesterone in Oil. For some reason, this medication has a bad reputation for being really intimidating, and it doesn't have to be. So we're going to show this video, and then I'll see what questions you have and try to share some other little pointers with you just to prove to you exactly how easy this is, and you can prove everybody wrong that had you worried about it. So Craig, if you'll cue up that video, and then we'll talk on the other side. Your healthcare provider has recommended that you take progesterone in oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone in oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone in oil and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all, and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol, but with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to one line or two to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it. Just one time. We know you're already clean. Just wipe it one time. Separate the tissue. Remove the top from the needle. Put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone in oil. Excellent. That wasn't so bad, I hope. I know people are intimidated by the longer needle with the as opposed to the subcutaneous injection needles that have been given with some of the other medications. But it's important that this medicine go into the muscle of the hip. It is an oil-based medication, and it is absorbed better if it gets into the muscle. If you put it directly into the fat, it may just sit there for a while. It'll probably still be absorbed, but it does better if it's directly into the muscle. Certainly, you're not going to have redness or irritation or lumps or bumps or tenderness if you put the needle in all the way and make sure that it is deep into the muscle. It's only when it leaks out into the fat that it's going to cause some of those bizarre symptoms like that. So what I do for my patients is right after they have their egg retrieval, I will take a Sharpie and draw little parentheses on their hips, right where that injection is going to go. Just because the spouses are usually pretty good at hitting targets. Again, here's my diagram, and I would just draw parentheses right in there so you can give the injections anywhere right in the parentheses. Sometimes I'll have patients try to give it right in the middle of their hip, and they think, or right in the middle of the buttocks, and they think, oh yeah, that's where I've got lots of tissue, so I'm going to make sure that I get it right there. Actually, the way women are built, that's where you have the most fat is going to be right there. Again, this needs to be in the muscle. So it's way up in the corner, and that's why you want to put the needle straight in all the way and then administer the medicine. Now, some people ask me, what if I do see blood? Do I need to pull back? And they're a little intimidated about that. Actually, in nursing schools now, that's no longer even taught that you should pull back. I've been doing this since 1981, and I have never given an intramuscular injection where I pull back and I get blood. You may, or tomorrow may be the first time I ever see it. But it's so uncommon, I wouldn't worry too much about pulling back on the plunger before you put into the medication. So I'll open it up now and answer any questions that you have.
Thank you, Karen, very much. So first off, I just want to remind everybody, if you are joining us on either Zoom or Facebook, feel free to type your questions right in there. On Zoom, you can put it in the Q&A section. On Facebook, you can just type it right on the page, and we will get to everybody's questions. This one, as you mentioned, Karen, a lot of times there's the most questions about this just because it's a little bit more complex. People think or they've heard things, and so this is a great way to kind of put those potential thoughts to bed. So one of these questions is very basic, just says, what does the progesterone in oil actually doing for my cycle?
Great question. I love it when patients ask specific medical questions and want to know why they're doing what we're asking them to do. I love that involvement. So progesterone is a hormone that the leftover sac that the egg was in makes after ovulation. So after ovulation, that sac that the egg was in becomes a functioning gland. All glands make a hormone. This hormone is progesterone. What happens with this is it stabilizes the lining of the uterus. Estrogen builds the endometrium or the lining of the uterus, and progesterone stabilizes it. So in a spontaneous cycle, the lifespan of that corpus luteum is about 2 weeks. And then after that, the progesterone levels fall if there's not a pregnancy, and that's when the period starts. When we do IVF and sometimes other procedures, certainly with IVF, we not only just remove the egg, but we also remove the fluid that's in the sac as well, that's in that follicle sac. So sometimes that gland may not function quite as well as we'd like, and the progesterone levels may not be quite as high as we like. So that's why we give progesterone. It's going to stabilize the lining of the uterus, and you'll continue to take it through the early part of your pregnancy. Your provider will tell you exactly how long. But you'll continue to take it, have a pregnancy test, and once it's positive, you'll continue taking it a bit longer.
All right. Thank you very much for explaining that. I think it's good to understand the background of why you're taking all these medications, and so it's great that people are asking those questions.
Absolutely.
Another question that just came in, and so this may have come after when you were just discussing a little bit about some of the shot and the spot to put it in. Somebody just said, I'm nervous about this shot. How will I know if the injection is in the muscle or not? What damage could I do?
If you give it, it would be hard to do damage, probably wherever you gave it. It'd be really hard to do damage. But if you give it in that muscle in your hip, that's a really big muscle. And if you do it way up in the corner of your hip, like I showed you in this picture, if you do it way up here, it's going to be pretty easy to put the needle all the way in and make sure that it's up to the hub and it should be in the muscle. If it's not quite in the muscle, it's probably going to be close enough. But it's very important you put the needle in as far as it'll go. People worry about hitting a nerve or hitting a blood vessel, or in thin patients, you worry about hitting a bone. Even if you did hit those things, it's not going to hurt anything. It may scare the giver just a little bit if you hit bone, but the patient, the one that's receiving the injection, isn't going to notice anything different at all. There's a big nerve that runs right down near the middle of each side of the buttocks that people worry about hitting. So if you stay away from the middle, you're not gonna have that problem at all. Way up in the corner. That's the most important thing I can tell you. To give it way up in the corner, and the other thing is to put the needle straight in all the way. Actually, when people take this injection, they're amazed at how much easier it is than they ever thought it would be.
That is great. Thank you. We're trying to put people's mind at rest and at ease so that you feel comfortable and know that you're probably walking in with a little bit more discomfort or nerves than you actually will walk out of this whole process with. So it's great that we can make you feel comfortable now so you don't have to feel worried about it later. So this, I feel like you touched on it, but again, just because the question came in and it came in a couple of times, so it's something worth touching on again. A friend of mine injected their progesterone and saw blood in their syringe. This just seems scary to me. I know you said it's not a big deal, but how can I be sure that I'm not actually sticking it into a vein, and what could potentially happen?
it is so unlikely you could stick it into a vein. So don't let that be the least of your worries. That's not going to be any problem at all. If you do see blood, just pull back the needle just a millimeter or two, just a little tiny bit, and go ahead and administer it. If you put a drop of blood into the bathtub or even the toilet or the sink or whatever, a drop of blood is going to turn all the water to where it looks like blood, even though it's just one little tiny drop. So a little tiny drop of blood is going to make the fluid look like it's blood tinged or maybe even just all blood. But it's fine just to go ahead and give it. It is unlikely you're going to pull back any blood. You may have a little spot of blood when you take the needle out, but keep in mind there's blood running through every part of our body. So it's easy to nick a little vessel going in or out, but it's not going to cause any untoward problems at all. So please don't worry about that. Another thing that patients ask me about is, should they stand up or lie down, or what's the best position to be in when they are having these injections given to them? I recommend that people stand up, and whichever side you're getting the injection on, just lift that leg up a little bit to take your weight off of that leg. And that actually relaxes the muscle. So if you think about relaxing the muscle fibers, when you put the needles in there, it's going to be relaxed already. If you're tensed up when the needle goes in, that can cause a little bit more soreness. It's hard to say just relax, but that's the right thing to do. Relax, let those fibers relax a little bit in the muscle, and whoever's giving your injection will just put the needle straight in all the way. It's for you, it's unlikely to feel any different than any of the other medications that you've taken. For the person giving it, it's thicker. It is in oil. I said in the video that it's going to likely be sesame oil or peanut oil. We're fortunate that Mandel's is a compounding pharmacy, and they can put it in some custom oils like olive oil for those people that have allergies, or in ethyl oleate. There's some differences in absorption, so your provider will tell you if you should use ethyl oleate or one of the more conventional oils. So they will work with you with any allergies or issues that you may have. But again, it's so important you go in the upper outer quadrant of your hip, take your weight off that leg, have the giver put the needle straight in all the way, push in the medicine, and then take it right back out. Again, whoever's given the injection, you have to push a little bit. You have to push the oil through the syringe. But for you, it's not going to feel any different.
Thank you very much, Karen. And one thing we can just throw out there now, this is perfect time to say all of these videos, since they will be archived and on our website where you can go to mymandelsPharmacy.com and see them, this might be a good one that you can have your partner or whoever's going to give your shot watch it with you, just so that you can feel a little bit more comfortable that both people are, they feel comfortable with the process, and there's no surprises when you're giving the shot, because that's what nobody wants that. So that's a great chance to go check out what's over there on the website and watch those videos. So I do have this question that just came in that said, I left my progesterone out at room temperature and I forgot to refrigerate it. It's been 3 days now. Is it still okay?
Great question. Progesterone does not need to be refrigerated, just like you don't put your olive oil in the refrigerator. When you put an oil-based medicine in the refrigerator, it's going to make it thicker. It'll be cold and thick, and that would make it harder to give. So I would recommend this just be kept out on your kitchen counter or bathroom counter, just in a safe place away from children and pets, and then keep it at room temperature until it's time to administer it, and then just put it right back on that same counter after you give it. So progesterone in oil, in any of these oils, does not need to be refrigerated.
One less thing to worry about there. Glad that question came up. And we do have another question that just came in. It's kind of a similar theme we've gotten for pretty much every product. But what do I do about potential welts or soreness from my injection with progesterone? Is there something I can do beforehand, or do I just treat it after the fact?
Great question. And that's what people really worry about. Not only are they worried that the injection is going to be uncomfortable, or that they might have some adverse effects afterwards. I can really promise you, if you put the needle all the way in, it is so unlikely you're going to have that. A few things that you can do to minimize that likelihood. One is you can alternate hips. You can do it on the left one day and on the right the next day. Also go to different places in that target that your doctor or nurse will draw for you. Ask about if there's another place that you can give it. That is my favorite place for patients to take the medications, because that muscle is a little bit shallower and it's a big muscle. I generally prefer that patients not take it in their arm or their thigh, just because it can be a little bit more sore. The muscle in your arm is smaller, and the muscle in your thigh, it tends to be a little bit more uncomfortable as well. Other things that you may want to do is warm it up before you give it. Warm up your hip. You can put like a heat pack on there. Some people say cold, but I always go for warmth before an injection that's oil-based. Just put a heating pad on your hip to administer, 5 or 10 minutes before you administer it. That also helps to relax the muscle fibers. There are patches that are available called Sonera patch that you may want to consider if you're really intimidated about the discomfort. The symptoms that you may have afterwards, especially if it does leak into fat a little bit, would be some redness or local irritation. Sometimes it can actually itch a little bit. So you can put a topical cream like Benadryl or a cream like that will help with the itching. The redness or lumps or bumps, should you have that, I would recommend you just alternate sides and go in different places in that same targeted area for the injections. If you should have problems with redness and swelling and it feels hot to the touch that you're concerned about it, always ask your healthcare provider. And your provider may have some extra hints for you just to make sure that it's easy for you and goes seamlessly. I have patients that dread taking the progesterone injections. And then when I tell them that they're sufficiently far enough along in their pregnancy that they can stop taking it, they're begging me to stay on it. It becomes almost like a crutch. And I thought, wait a minute, you said you didn't want to take it. You were worried about it. But then come to find out it's not nearly as bad as what you thought about. So again, I've said it over and over, put the needle straight in all the way, and give the medication.
Thank you so much, Karen. We appreciate it. And I will say right now that we've gone through all the questions. So at this point, we can open it up to pretty much anything. If you have any questions about any of the 3 products we talked about, or if you have anything tangentially related to the conversation tonight, feel free to hop into the chat on Facebook or jump into the Q&A section on Zoom, and you can type it in that way. And other than that, I will throw it back over to you, Karen, just as we're getting close to getting ready to wrap up with the program tonight.
Perfect. Well, I really appreciate y'all being with us tonight. We want to do this program for you, the patient, to make this journey a little bit easier. Your healthcare provider has an awesome relationship with Mandel's Clinical Pharmacy, and we want to work together to ensure that your journey is as smooth as it can be, and your understanding of the medications, their purpose, and how to mix and administer them is as clear as it can be. So thank you so much for giving us this chance to speak with you tonight. I know it's in the evening and your own personal time, and we really appreciate your taking this time out of your day just to have a better understanding of these things. We want all of your journey to be easy. Always feel free to reach out to your healthcare provider or to one of the pharmacists or clinical team at Mandel's Specialty Pharmacy, because we're all wanting to work together to make this as easy as possible for you. Keep in mind that all of the videos from this PharmAssist program are available on Mandel's website at mymandelsPharmacy.com /PharmAssist. But when you go to the Mandel's website, it's really easy to navigate to find where these videos are. Or you can find it on Facebook, on my page, or on Mandel's Specialty Pharmacy page. So you can maybe even play the video right before it's time or even during the time that you are preparing and administering your injection, just to have a little backup. I joked a little earlier that it could be like a Jane Fonda workout video, but probably most of y'all watching that are wondering, when was Jane Fonda doing a workout video? But you can just prepare it along with the videos that we have. It's fine to get second opinions. There are 4 of us from around the country who are preparing these videos, so you can get second opinions from all 4 of us if you'd like, just to make sure that you're very comfortable with it. And always feel free to ask any questions. Craig, do we have any more questions that are coming in tonight?
No, that's it. The only question that I have is I just would love to know how many people here tonight actually know who Jane Fonda is at all, because that would make me feel much younger to know that other people are aware. But thank you very much. I want to say thank you so much, Karen, for everything tonight. Thank you for your time. Thank you for being a part of the program with us today. And just to recap, Karen gave you all the key information, but all these videos will go up. You can not only just watch the full video from beginning to end, but you can search for just your individual video for the medication that you need to see. And all that is available both on our Facebook page, where you might be watching this right now, as well as also at our webpage. So you can just go right over to mymandelsPharmacy.com. And there's tons of information there, plenty of information, including the PharmAssist program. And this program will continue, the PharmAssist program, every Monday night at 7 p.m. Eastern Standard Time. So you can join us any Monday night. We will be here. We will walk through different products. We will be sharing some new information, and always here with the Q&A with great nurses such as Karen to be able to answer your questions. And other than that, I just want to say thank you, everybody, for joining us live here on Facebook as well as in the Zoom. And we look forward to seeing you here again next Monday night at 7 p.m. on the PharmAssist program, brought to you by Mandel's Clinical Pharmacy. Thanks again. Have a great night.
Thanks, everyone. Good luck to you.